It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I actually had a very sad phone call from a gentleman in the UK who says his 80-year-old sister is in hospital in palliative care. And he had the following question. He said, my sister went into hospital with a pneumonia, and they were treating the pneumonia for a couple of days with antibiotics. Apparently the pneumonia would clear up. And then they told his sister's children that the only way forward here is palliative care, that, they can't cure the pneumonia and, she shouldn't live and she should just be moved to palliative care, where they now stopped all nutrition, all water, and where they're giving her morphine and midazolam. Now, he asked me if this is a normal process and whether there wouldn't be any other avenues for his sister, who in the past apparently has mentioned she wants to live, she wants to have everything done. Now, I said to him that, if they can't cure the pneumonia within a couple of days, A, that's not enough time. B, she should have gone into ICU, and apparently they denied her an ICU admission. Now, to me, that is rather shocking, but also not surprising, given that this gentleman called me from the UK. I mean, the NHS is an absolutely shocking system. In 2024, I explained to the gentleman that if they are giving her morphine and midazolam instead of continuing the antibiotics and getting her into ICU, maybe start this lady on BiPAP or on CPAP or on high-flow nasal bronchs. But if they give morphine and midazolam instead, without consent from a patient, that is definitely euthanasia. It's hastening death. If they are stopping also nutrition and water, one could argue it could be worse than euthanasia, could be perceived as murder. I leave that to you to decide, to anyone viewing this, what that might be. He is not next of kin for his sister. His sister's children are the next of kin. They're the decision makers. He's going to talk to them, he told me, and sharing my thoughts on it. It is extremely sad that in 2024, that's the best the NHS in the UK can offer. I do believe that there's only one person that can take life away. That is God, and not, someone giving medications. You can give medications to heal people, to try to improve their lives. You can also give medications to end people's lives. And I know what I would want for myself and for my family in a situation like that. I really would like your thoughts on this topic, and I would really like you to comment below what you think, whether that's the best the NHS in the UK can do, or whether you think, everyone deserves the right treatment at the right time, irregardless of their age or their gender or their religion or whatever the case may be, irrespective of what colors they're wearing. Everyone deserves a chance. If people want to have palliative care, that's a whole different story. That needs to be respected too. But it's all about choice and control, and it's all about respecting people's wishes. Let me know what you think about this topic, and I would really welcome your comments. Like I said, it is very shocking to me, but also not surprising. Look at what the NHS did in 2017, 2018, when they were killing Alfie Evans in Liverpool at Alder Hey Hospital. If you haven't heard of Alfie Evans, type into Google Alfie Evans. There have been many other children and adults that have been prematurely killed by the NHS. I have no other words, and I think it's absolutely appalling. And I think we need to start speaking out about these things, because it is very inappropriate. It is not a very humanistic approach. It's not a very holistic approach. It's a defeatist approach, I believe. If we as a society think that this is the best we can do, we are completely on the wrong track if we're not respecting the wishes and the lives of everyone in this society. So please leave your comments below. I really want to hear from you. And because we get so many questions from families of critically ill patients in intensive care, that's why we created a membership for families of critically ill patients here at intensivecarehotline.com. And you can become a member if you have a loved one in intensive care by clicking on the membership link or by going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have access to 21 ebooks, 21 videos that specifically talk about how to steer the territory that is intensive care so that you can make informed decisions, have peace of mind, control, power, and influence. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly, once again, making sure that you have peace of mind, control, power, influence, and that you will make informed decisions and that your loved one gets best care and treatment. I have worked in critical care for over 25 years in 3 different countries, where I also worked as a nurse unit manager for over 5 years. I have been consulting and advocating for families of critically ill patients in intensive care since 2013 here at intensivecarehotline.com, and I can say we have saved many lives with our consulting and advocacy, and you can verify that in our testimonial section as well as on our podcast section with clients. By me talking to doctors and nurses directly, you will see that the dynamics will change in your favor because I know what to look for. I know what questions to ask. The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. We also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. Also, these are once in a lifetime situation. You can't afford them to get wrong. That's why I also represent you in family meetings with intensive care teams or with hospital teams. And I'll make sure, once again, your loved one gets best care and treatment. But I also make sure you have a bulletproof strategy when you go into a family meeting with intensive care teams. Because let's just take this example from today, from my quick tip video, where I said the family really has no idea what they're doing, and they probably have been dragged to a meeting where they've been told that their loved one will have palliative care. Now, by you not going into a meeting in a situation like that, you're sending a very strong message that you are not playing their game. So you need to work out what this meeting is all about, and you need to have a strategy. 99% of families of critically ill patients in intensive care have no strategy whatsoever. This is when these things happen in the first place. If you have a strategy, those things don't happen to begin with. So all of that, the consulting, the advocacy, you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families of critically ill patients in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and share it far and wide. And comment below. I really want to see your comments about this specific topic today. Let me share your thoughts. That would be amazing. I hope you all have a great day. Take care. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.